Hi, welcome. We will start right on time. Thank you for being here. All right, it's 2 o'clock. Hi, Early Head Start family, ECE leaders, and community in general. Welcome to our third Early Head Start Rising Summer Webinar 2022. I am Zuly Vasquez, the Associate Manager of Early Head Start Programs here at the National Head Start Association. We kicked off the Early Head Start Summer Series 2 weeks ago with the future of early learning is relational with Isabel Howe. And last week we had a session about brain development. Neuronurturing, it makes a difference with Deborah McNallis. If you join us in the last 2 weeks, welcome back. If you missed one or both previous live sessions, the recording is available for you on our website. For those of you who are joining us for the first time, I'm very excited you're here. Thank you for being with us today. Please share in the chat your name and where you're zooming in from. Before I introduce our guests today, I want to remind you that these Early Head Start webinars are part of our Early Head Start Rising campaign. If you would like to know more about the Early Head Start campaign, please visit our website. You will have the link in the chat. Feel free to check it out. It is my honor to introduce our presenters today. Dr. Glassy and Dr. Loria are both pediatricians. Dr. Glassy is a retired pediatrician and a child advocate. She does a lot of child advocacy work locally and nationally, and is a clinical professor of pediatrics at the University of Washington. She's also the co-chair of the Executive Committee for Caring for Children, National Health and Safety Performance and Standards, Guideline for Early Care and Education Programs, 3rd and 4th editions. You're probably very familiar with Caring for Our Children standards. We all use it when working in the field. You probably have the Caring for Our Children book next to you on your bookshelf or the digital version saved in your computer, as I do. Dr. Glassy has presented several times to the Head Start, Early Head Start community for the past 20 years at the state and national level. I am very happy she's presenting for us today. Our second guest is Dr. Loria. She's an assistant professor of pediatrics in the Division of Developmental Behavioral Pediatrics at the University of Texas, Southwestern Medical Center in Dallas, Texas. She practices as a board-certified general pediatrician and serves as the medical director of the Region Center for Foster Care Excellence and Integrated Trauma-Informed Pediatric Medical Home for Children in the Child Welfare System. Her clinical and advocacy work focuses on the impact of childhood toxic stress on long-term health outcomes, with a special interest in the care of immigrant children and children involved with the child welfare system. Dr. Loria currently serves on the executive board of the Texas Pediatric Society and is the Texas Early Childhood Champion of the American Academy of Pediatrics Council on Early Childhood. Thank you, Dr. Loria, for taking time out of your busy schedule to present at the Early Head Start Summer Series. To the attendees, if you have questions, please put them in the chat. We will have some time to answer some questions at the end of the presentation. Dr. Glassie, Dr. Loria, welcome again. We're happy to have you.
Hi there, thank you so much. If you want to go ahead and put up our slides there. It's so great to see so many people from all over the country. I wish we could just be in person. I'm Danette Glassie, and you heard about me and Dr. Loria.
Yeah, thanks, Dr. Glassie. So hi, everybody. Hi, Early Head Start. Thank you for everything you do in and outside of your actual job description. So Dr. Glassie and I just wanted to start with, on the next slide there, just to get an idea of what has been coming to mind for you all about vaccines, masking, and its impact on children. We're going to cover these topics, but we also want to get an idea of maybe what's been top of mind for everybody and make sure that we're addressing that throughout the talk. So I am going to attempt to share a word cloud here and see if it will cooperate for us. So I'll put the link in the chat to put in your answers, and then you can also, if you're on your phone or another iPad or mobile device, if you go to www.menti.com and then put in this code of numbers, you should be able to share, I think, 1 to 3 words that come to mind.
COVID has really consumed all of our lives, professionally, personally, and emotionally. And so I'm glad you could join us to hear what we've learned in the most up-to-date information.
Okay, hopefully that's projecting on everybody's screen as well, but the answers are starting to come in. And so I'm seeing some questions about masking, not appropriate, and then vaccines for kids not old enough. Let's see, perhaps some concerns about development. So I'm seeing language, social, emotional, and then some things on here about maybe risk and concerns for families. So things being difficult for families, maybe some parent or caregiver resistance. I don't know if that's related to masking or vaccines. And then lots of feelings, words here about perhaps the work you all are doing, or if you all have children and vulnerable family members, some stress and anxiety and feeling sad and scared. So I'll give it a couple more minutes here. And Dr. Glassie, I think we're going to cover a lot of these, but we'll also have, we intentionally wanted to have a significant amount of time at the end of the hour to also just chat as a group for any of the topics that perhaps Dr. Glassie and I don't cover today in our slides. All right. Thank you, everybody. I'm glad the word cloud worked. Lucy, I think I can stop sharing here and we can move over to our slide set. Thank you. And then I'll pass it back to Dr. Glassie. Or if you go to the next slide, Lucy. Okay, perfect. Thank you. Actually, it's me. So we'll start with just kind of lay of the land and what's been going on over the last 2.5 years, but certainly more recently. So this is a graph that's kind of depicting the number of child COVID-19 cases at the beginning of the pandemic, and then you'll see there that big giant spike in early 2022 this year, the Omicron variant really impacted a lot of kids. And so there was a week where there were more than 1 million cases, and that was the peak. What you'll see here then after that peak in February 2022, the numbers have drastically come down. And over the last month or so, kind of May and June, we are seeing a slight increase again in the number of cases. And as of last week, so June 9th, there were about 88,000 kids COVID-19 cases that were reported, which was similar to the week prior. And so even though the numbers in general have been decreasing substantially since Omicron, when we look a whole year back, the number of kids that have been impacted by COVID, which this one doesn't actually include home tests that are positive, so the numbers may actually be higher compared to a year ago. The numbers are also much higher than reported. And then on the next slide, you'll see here, this is just depicting regional trends. So the last 2 years or so, it tends to kind of peak in the Northeast and then the rest of the region sort of follows. But what you'll see here is very similar. So in the Midwest, Northeast, South, and West, that big spike up there, that was Omicron in January 2022. And then same trend, they've come down and then starting to see a little bit of a rise. But what we wanted to point out is that the trends are similar all throughout the country in all the different regions. So still something that's occurring and impacting families throughout the US. And then what you all are probably interested in, because we're still also trying to figure out where we're going with this, is a lot of concerns about the vaccine and where that's going. So I'm going to pass it over to Dr. Glassy, who will talk to us about the vaccine and some updates as they're coming.
Great, thank you. And thanks to all those who've entered since we first began this conference. Go ahead and put your questions in the chat if you have them, and we'll try to answer them as we're going and certainly have time at the end. So at the beginning, I think you all expressed exactly what we've all gone through. Remember the early days of COVID when we were so frightened and nobody knew what was going to happen with it, except that people were dying, and in large numbers and very quickly, and tragic, terrible deaths. And now we know a lot more about this. Just a quick review: it's spread through the air, maybe a little bit through touch, but it's a respiratory virus. And we've had not only the first COVID virus, but it's mutated a little bit into the Delta variety and several Omicrons, subgroups of Omicrons, and they all have a little different characteristics. The Omicron, you saw that huge spike in the last winter when Omicron hit the scene, and that's because it was just so much more contagious. You can reduce your risk of catching these things by doing things that reduce your risk of spreading things through the air. And so we've all been thinking about ways to be farther apart, maybe not even in the same room. Here we go with our Zoom conference again. And of course, masks and proper masks that reduce your risk of spreading secretions and breathing in secretions. The real miracle here, though, was the very quick development of a vaccine. Of course, what the vaccine researchers were using was that original blueprint of the original virus. And it's done a marvelous job of reducing our risk of death and hospitalization, but Omicron was able to be a little sneaky and get around it, and we can still catch the COVID virus, even if we've been vaccinated. So that's where some of the confusion, I think, starts happening and misinformation starts flying. I just wanted to kind of review where we were with everything right now. So here's where we are with the vaccine for 5 to 11-year-olds, the closest that we have numbers for our group in Head Start and Early Head Start. You'll see that most children have had both of their doses. It looks like once parents have committed to that first one, they're going on to get the second one. It's very, very close. And as time has gone on, it's continued to increase, but at a much slower rate. Go ahead and turn the slides, please. And the proportion of the 5 to 11-year-olds who have started their vaccines by state is listed here. And you can see that it's a third to a half in most states. And that compares to the teenagers, where it's more like 80% of teenagers, in some states even higher. So a little less parent buy-in or access to these vaccines, which is unfortunate. Keep going on the slides for me, please. You saw that the number of cases has increased, and here's a slide that kind of breaks out total number, adult cases and child cases. And what we're seeing with the relaxing of the masking mandates across the country and testing mandates, that there was an increase again of cases, and it was paralleled in children. Go ahead to the next slide. So let's circle back on that miracle, the vaccine that has significantly reduced death and hospitalization. And the exciting news that we're on the verge of getting a vaccine that's safe and effective for children. I just wanted to review a few things that have just come out this week that didn't make it into our slides. But it turns out that 442 children 0 to 4 years old have died from COVID-19 since the beginning of the pandemic. And that was as of June, the first week in June. Compare that to 815 deaths in the 5 to 18-year-olds. Now, so half the number of children have died in the 0 to 4, but that's a higher death rate for the children in the 0 to 4-year-old range. We know that for other viruses, especially children 0 to 2 years old, are much more vulnerable to most viruses, and they're really bad effects. There's higher hospitalization rates and higher death rates for most bad respiratory viruses, and COVID is no different. So we're very excited to hear about the vaccines that are coming. Pfizer and Moderna both have a product that's being reviewed today. And in the Pfizer, it's a 3-dose series. The children who have 6 months to 5 years who are going to take the Pfizer vaccine will have one vaccine, the second one 3 weeks later, and the third one 2 months later. And they found that this was 80% effective at preventing any illness. So pretty effective at even preventing you catching COVID, and a reduction in hospitalizations and deaths, of course. The Moderna product, it's only a 2-shot series. The children who choose that between 6 months and 5 years will have 1 shot, and 4 weeks later will need their booster. And this one was also 51% effective at preventing breakthrough case of illness, and much decreased death and hospitalization rates. So we're very excited about this for our infants, and for the help that we'll finally get for this vulnerable population. More vulnerable, I might add, than the 5 to 11-year-olds were. Go ahead and advance the slide. So here's a little graphic that kind of explains how vaccines work. And I'm going to ask our Head Start people to go ahead and play that for us.
Vaccines work like invisible coaches. They partner with your child's immune system, teaching it how to stay strong and healthy when exposed to viruses and other threats. Vaccination is one of the most effective ways to protect your child from preventable diseases and to help them thrive. While some people are just hearing about them now, vaccines made with messenger ribonucleic acid, or mRNA, have been studied for decades. Unlike many childhood vaccines that contain tiny parts of a virus or bacteria to train the immune system, mRNA COVID-19 vaccines don't contain any parts of the coronavirus. Instead, they teach the body to recognize the virus in the future. The mRNA in the vaccine teaches your child's immune system to do what it would normally do, but faster and better. As soon as the vaccine is injected into your child's upper arm, it goes to work. You've probably seen pictures of the coronavirus, a ball covered in spikes. Vaccines using mRNA teach your child's body to make spikes out of proteins. These proteins look like spikes on the virus that causes COVID-19, but aren't actually the virus. Your child's immune system recognizes that the spikes shouldn't be there, so it produces antibodies that eliminate those spike proteins. The antibodies then remember what to do if your child is exposed to the virus in the future. This all happens very quickly. After the mRNA in the vaccine instructs your child's body how to make the spike protein, it's broken down in a matter of hours. A second vaccine dose about 3 to 4 weeks later reinforces the earlier instructions so that the immune system prepares itself even better. 2 weeks after your child gets the second dose, they are considered fully vaccinated. Most vaccinations, including a COVID-19 vaccination, can sting. Some people have a sore arm afterward. Just like adults, some children may experience fever, chills, headache, or nausea. Those side effects go away quickly and are a sign that the immune system is learning how to protect the body against the virus, similar to how your muscles feel sore after a workout. Serious side effects from vaccination are very rare. Of children who do experience side effects, most feel back to normal in a few days. If your child is fully vaccinated, they are far less likely to get infected. Or, on the rare chance that they get COVID-19, they're far less likely to become seriously ill or die. COVID-19 vaccination gives peace of mind because it greatly decreases the risk of COVID-19 infection. Like a good coach, the vaccine does its job, and your child will be in good shape, ready to thrive.
Great, thank you. Go ahead and advance the slide for us there. One of the things that happened with our pandemic was a pandemic of misinformation, and some of it was disinformation, someone actually lying to you and trying to get you to think bad things to manipulate you, and some of it was misinformation. Maybe someone didn't understand and accidentally passed on information that wasn't quite exactly accurate. And of course, there was the emerging information. We didn't know about things, and we're still learning about so many things. So lots of chances to kind of go down the wrong paths. So how do you find that reliable information and make sure that you're not providing misinformation, or you learn about the latest information that's coming out? This is a list for you of all the things that we think are very credible about COVID and COVID vaccines. And of course, always we refer you back to your local health department. They are the ones who really have the authority to kind of help you because they know what's going on in your particular area and the resources you have. Sometimes we've had lockdowns and more strict requirements because your local healthcare is overrun and there's no more room. And so they're going to be the ones who know best about what you should be doing. Go ahead and go to the next slide. I wanted to remind all of you about your important jobs, not only, of course, to take care of the children in your charge and the families that have come to you, but also as that trusted advisor. And it's really important for you to recognize how important you are to parents and answering their questions. The American Academy of Pediatrics has all kinds of graphics and fun and information, just like that little video we just showed. They can help you with your own Facebook pages or handouts for families, social media if you're doing that at all. And so definitely I encourage you, if you look in the middle of this slide at the bottom, it says healthychildren.org. That's where a lot of this information is. That's a lot more fun to watch. I loved the dancing band-aids in that graphic that we just watched. So if that would help you with your passing on information to family and friends, please use those things. Go ahead and advance the slide. A quick reminder about caring for our children. You heard I'm still working on this. Caring for our children, for those who don't know, is a national resource of all the best knowledge around health and safety in early care and education settings. It was originally put together by a huge team of health professionals and early care and education professionals, mental health professionals, administrators, and really is a compilation of the best knowledge we have on best practices. You can find an online version of this very thick book at nrckids.org/COFOC. Go ahead and advance the slide. But of course, COVID came and kind of changed what we did. It changed what we did in early Head Start. It changed what we did in Head Start. It changed what we did in what was safe in childcare. And so when you go to look at it, each standard that has been affected by COVID will state that, and it'll say what are the important considerations, knowing that we have this terrible, deadly virus in our midst. This slide and the next slide are a list of all of the standards that have been changed or modified to reflect the information that we know about COVID. So when you're thinking about some of your processes and wondering if it really is COVID safe, you can still go to Caring for Our Children. The online version is as up to date as we can get it. We're running as fast as we can to get those new COVID things in the online version. Go ahead and change the next slide. So next we're going to talk about masks. And I saw in our word cloud that there was a lot of concern about masks. So I'll pass it back to Dr. Gloria.
Awesome, thank you. Yeah, I'll try to cover, I think, maybe what questions tend to come up that are common about masking. But if there's anything that Dr. Glassy and I haven't covered, feel free to use the chat to ask some questions too, and that way we can collect them and answer them at the end if we don't address them. So masking wise, the American Academy of Pediatrics strongly recommends that anyone who's over the age of 2, regardless of their vaccination status, should wear a well-fitting face mask when the community level risk is high, is considered high. So that may be like dictated federally, but again, like Dr. Glassy said, every local health department is a little bit depending on the risk to the community. And then face masks, we know, are safely worn by children 2 and older. It's not as safe for children less than 2, just developmentally, the kids are not able to control how the mask is fitting, and it can be a choking and aspiration risk. But we do know that kids 2 and older, and the vast majority of kids, even those who have some health conditions, are able to wear the mask appropriately, and are able to wear the face mask and understand that it's what it's being used for in order to protect themselves and protect their classmates and friends and teachers and loved ones and grandparents from getting sick with the virus. There are certain populations of children where the mask may not be appropriate, or for those kids, they still remain vulnerable to getting the COVID virus. So Children who are less than 5, depending on, it might be in the next few days or week or so. But children less than 5 that are currently ineligible, we strongly recommend that they continue to wear the mask to protect themselves. And then children who are immunocompromised, where they may have a health condition and their immune system is either weak or unable to create those antibodies, those proteins that we need to fight off the infection. Some of those children may require the mask to continue to protect themselves if they're at severe risk of catching COVID. And then children and maybe older youth who have special health care needs, who even if they're vaccinated, but they may still be at risk for severe disease. Again, a lot of the kids who may have health conditions where their immune system is really, really weakened, if they're on chemotherapy or if they have a condition where they need to be on medication that suppresses their immune system for a period of time, for those kids it may be wise and appropriate for them to wear a mask if they're able to. And then for children and kids who are unable to, let's say they're vaccinated, but for whatever reason, they may not be mounting the antibodies that they need to protect themselves. Those, if they know that about themselves or their doctor has told them that they are not able to create that response with the vaccine, then those kids, we recommend that they also wear their mask to protect themselves. And then what kind of mask? I think most kids are pretty familiar with what all the different masks look like. So any like a mask that has multiple layers of whether that's a fabric or these types of masks, the ones that we use in the hospitals, as long as it's the right size for their face. So there are child size masks. And even though some of them are labeled child, they may still be big for depending on the age of the child. And so families should really try to find a mask. And what's important is that it covers the nose and the mouth, and as much as possible creates a little bit of a seal. So to protect it from, try to cover as much of the nose and mouth and chin, but not that it's hanging so big that the particles and air can kind of go through those spaces. And so it should fit pretty snugly, but not tight and uncomfortable. And then I tell my families, depending on, the risk here in Texas is kind of going up and down a little bit. So for my kids that I take care of in my clinic who have an immunocompromised system, where their immune system is really weak or isn't able to fight off infection well, I will sometimes counsel them to even use like a N95 mask, depending on the situation where they're going. So if they're going to be in a large environment where they're not sure if the majority of the people there will be vaccinated, I think it's wise. I lean on the side of overprotection than I would risk as a pediatrician. So hopefully that covers, I can put some links in here with some additional information from healthychildren.org and the AAP that has specific strategies about the mask. And yes, so Dr. Galassi, really great point. There is a lot of concern initially in the pandemic that adults wearing the mask would, would impact in a negative way children's language development or social emotional development. But now that we've been in this for a bit of a long haul, we do know that has not impacted language development and communication development or social emotional development. And so we have some materials there to also address that.
And even as our little babies and toddlers start to get vaccinated, the 0 to 6 month olds will not have a vaccine to protect them. And of course, the 6 months to 5 years, it'll take several months to get full immunity for those kids, even if they are getting their vaccines. And there will always be the chance that they could have a breakthrough case and bring it home to a family member who could succumb to COVID. And so again, staff to protect their littlest charges should still be wearing a mask if unless there's no COVID in your area. So we highly recommend you protecting the children in your care, and know that your expressive eyes and your voice and your touch are making up for them being able to see your lips. It's okay.
Then we can go to the next slide. So these are some tips and strategies, I'm sure with the work that you all have been doing and the families you all have been working with, you probably already know these strategies or even have more that we haven't thought of. But for the kids who are still anxious or not sure why the mask is on, these are some strategies that you can use to teach kids about the importance of masking. And so for kids under 3, it's best to sort of answer their questions very simply in language that they understand. And so, they might ask, like, why are people wearing face masks? And you can explain that it's to keep them safe and healthy so they don't get sick. Or you can even say, like, remember when mom or dad had a runny nose and we had to stay home and couldn't do fun things, like the mask helps us to protect us from getting sick. And then for kids that are older than 3, you can certainly start the conversation about the role of germs and how that can cause your body to get sick. And, some germs are good and some germs are bad. And the bad ones are the ones that can make us sick. But because we can't always tell whether germs are good or bad, keeping the mask on helps us to make sure that any type of germ, we minimize the risk of, we decrease the risk of getting infected with those germs. But, a lot of our kids, we've been doing this for a while, are pretty used to the mask. And so hopefully many of them have figured out, many families, and for you all as caregivers with Early Head Start, have been able to work with the children in keeping the masks on. And these are some really creative strategies about drawing and making them, like picking their color, giving them choices, all stuff that you all know and practice day to day. And then this next slide is about isolation and guidance, because I'm sure that has come up in day-to-day childcare settings and in early education settings with you all. So I'll caveat this by saying, like, the most up-to-date guidance is on the CDC. And so that's what we tend to follow and practice. And we also have on the AAP links to most updated guidance. So currently, if you do test positive for COVID-19 or have symptoms, regardless of whether or not you've been vaccinated, the recommendation is to stay at home from 5 days and isolate from others in your home. And so isolation means trying to stay away, being in your room, away from anyone else who's not been sick. And then we do recommend that you are the person who is having symptoms or does have the COVID-19 infection, that they continue to wear the mask so that it prevents, even inside the home, so that it prevents infecting others. And then there's a caveat here that if you were severely ill, then it's recommended that you should isolate for 10 days. I'd say that, at day 5, maybe check in with your doctor, whether that's the child or the parent or the caregiver, to see whether or not that's appropriate, depending on the family's risk and circumstances. And then even if you no longer need to isolate or quarantine after 5 days, we do recommend, the CDC does recommend that that person who had COVID or has symptoms continue to practice precautions until day 10. And that includes wearing the mask, avoiding travel, and then avoiding being around people who are at high risk, whether or not they've been affected. Because like Dr. Glassy mentioned, there's still some breakthrough infections, and there are individuals who maybe had one version of COVID and then the other got the other variant. So it's still possible that even if a grandparent or a classmate or a teacher had COVID before, with the other variants, they may still get COVID again. And then we'll also talk here about the impact on child health outside of the physical symptoms. So I'll pass it back to Dr. Glassy, and then we'll wrap up here and have some time for questions.
At the beginning, I shared the sad news that in the 0 to 4-year-old age group, 442 children have died from COVID, and that's a higher rate than older children. And so again, we're very happy to have these vaccines. We're very happy that the people in children's lives are still protecting them by wearing masks. And yet there's still other effects of COVID that we're going to get into. I want to address one of the questions here that came up from Jerry Stoddard, who said we're having a problem with parents refusing to use a mask or they're sending their children to school without a mask. And you know, that whole schematic that I told you about, disinformation, misinformation, and emerging information, whenever it's very confusing that in many people's minds, if you don't have to wear a mask, if the rule is you don't have to wear the mask, it must be safe to not wear the mask. We are very simple creatures as humans, and that's where our brains go. And so I would just have a conversation and find out what they're thinking, help them with the information that you may in your classroom have a caregiver who is high risk or a child who's high risk. Or of course, if you have young children under 2 that have the highest rate of hospitalization and death on campus. So I think just sitting down and having a chat is the best way to affect that. It takes time, unfortunately, and none of us have that right now. We're going in so many different directions, but I think that's the only way to address it. It's also good to maybe in your newsletters take a question a week and really kind of belabor it a little bit and kind of send out information that way. And peer-to-peer, if you have parents who you think are good communicators, asking them to chat with other parents about their choice to use masks and why. All right, so go ahead and flip to the next slide here. We're gonna move on to the other things that COVID has done to us. This was earlier in the year, these statistics from the winter, but there's been more than 200,000 children who've lost a primary or secondary caregiver due to the COVID-19 pandemic. So not only the physical effects, but also the grief and loss that's affecting that. And of course, we know that it's not just the love and care that they're missing, but perhaps this is affecting their housing and their food and poverty levels. To lose a primary caregiver, this is really drastic in the lives of children on all fronts. Go ahead and go to the next slide. In addition, just the anxiety and worry about all of the effects and our up and down economy now, there are soaring rates of mental health challenges. And it's not just parents and caregivers and pediatricians who are suffering the mental health challenges because of COVID. But of course, our children look to us for strength, and children, adolescents have had, with this pandemic, exacerbating the situation that existed even prior to the pandemic of soaring rates of mental health challenges. Go ahead and go to the next slide. I wanted to review a little bit in young children, signs of stress and perhaps mental health issues, because it's sometimes, as you know, it's not so straightforward. They don't have the words, they don't have the ability to express like the older kids and adolescents can tell you. Our youngest, our 0 to 3, it's even harder. But watching for those changes in behavior and abilities, even infants who are experiencing a lot of stress at home or around them will sometimes lose milestones. So you have a child who's maybe crawling and then suddenly isn't crawling so much, or had been pulling to a stand and now isn't even trying. Maybe they were verbalizing a lot more, even babbling a lot, and now they've gone kind of quiet. So in our youngest kids, definitely, I think that's one of the best predictors of what's could be happening to them. Of course, fearfulness and clinginess, you've probably seen that before. Another good indicator is changes in sleep. Changes in sleep can be from other things too, like sometimes when kids are making their new milestones, they suddenly don't want to sleep. They want to practice pulling to a stand and talking and all of those things. But you can tell the difference in that. Tantrums and meltdowns for our 1-year-olds and above, withdrawal, like I said, but even the kids in their social interactions, maybe not interested in the other kids anymore. You know how kids love to watch each other and interact and play, and suddenly not that interested in that. For the older kids who are maybe potty trained or potty training, some new wetting and soiling, and definitely tummy aches, body complaints, when they can verbalize, will often be the sign that they're undergoing a lot of stress. Go ahead and change the slide there. Dr. Gloria, go ahead and help us with what we can do about this.
Yeah, you all have been troopers throughout this whole endeavor of the pandemic, not just handling the infection and protection pieces of things, but certainly handling early intervention and mental health services. So Dr. Glassy and I just tried to put together some additional resources here, many of which you are probably all familiar with. And so your local, regional, or federal early intervention services, wherever that may be. So for us in Texas, it's called Early Childhood Intervention, spread out throughout the state. And then certainly for kids who are needing help developmentally, you may need to consider things like physical therapy, speech therapy, occupational therapy. And then depending on where you are, there are several resources to address mental health, whether that's the child or the family and parent unit. And some of those things may include mental health consultants if that's available to you. So for example, for us here at Dallas at the Children's Hospital, we have an early childhood mental health clinic. And then you may also, other options include evidence-based behavior therapy. So things like play therapy, parent-child interaction therapy. And then of course, for those that you're worried about more neurological, developmental, or behavioral concerns like autism or even mental health illness like anxiety and depression and PTSD, certainly talking with your pediatrician about whether or not other subspecialists are appropriate, like psychiatry and neurology and developmental behavioral pediatricians. And then of course the power of social support, right? So any community supports, you all know the communities you're serving. And so if you're able to connect families with parenting support groups, any cultural groups, school system, neighborhood associations, ways that people can get together who share a similar experience and can find some comfort and solidarity and knowing that they're not alone and they have social support. And one thing I always like to tell my families or when I work with our early childhood colleagues, you don't necessarily need a diagnosis in order to refer a child and a caregiver. If the parent is concerned, if you all are concerned as their caretakers in early intervention, making that decision with the family and the pediatrician to refer should not be dependent on whether there's a diagnosis. So if you are concerned or worried, I refer out to try to get our families the earliest possible intervention. And then on the next slide, these are some specific links again to share of potential resources to help both children, families, and communities address the mental health sequelae of what we've all been going through. And then finally on our last slide here, Dr. Glassy and I just wanted to also make sure that you all are thinking about taking care of yourself too. So we've all been, I don't know, some days I'm like surviving and thriving, and some days I'm just like existing. So please make sure that you all are taking care of yourself. You all, I mean, Dr. Glassy and I as pediatricians have the resources that we have within our clinics or institutions to help us to take care of our patients and each other. And for you all in your local communities, like as you're kind of adapting as you're going. And so you all have not had to be just early intervention specialists and caregivers for the kids, but you've probably had to be social worker and like health consultant and therapist. So we also want you to remember that you are also important and valuable and worthwhile, and you all need to take care of yourselves physically and mentally, because we know that if we're not taking care of ourselves, then we're not able to take care of others. So we hope that you are engaging in that part of your health as well. So these last few minutes, I think that was our last slide. We can stop the slides here for early Head Start staff. And then Dr. Glassy and I are really open to just having a group discussion here. If you have your video on, we can see you, but please feel free to either unmute or post your questions in the chat and we can address them as we go. Thank you all for your time and attention.
Yes, thank you. I'm going back through the chat to see if there's any other questions that came through, but please post it in the chat now.
Yes,
that looks like your
questions.
It does look like you're going to get our links in an email for those who registered, so that's good.
Any questions or comments, please unmute yourself. I'll put it in the chat.
Did Dr. Glassy and I do that great of a job?
I know. I do have one more thing to share that I didn't want to take up the time, but in my state, there are very few pharmacies that will give children, very young children, vaccines. And so I'm during the H1N1 flu epidemic in my huge King County where Seattle is, there was only one pharmacy that gave children the H1N1 vaccine under the age of 2. So parents were, their heads were exploding. They were in line for 8 hours to try to get their children vaccinated. I'm very worried about this rollout of the vaccine. And so it would be helpful probably for your programs to maybe contact your state health department and find out who is going to be offering the vaccines to the 0 to 2-year-olds for COVID-19 and where those are in your vicinities, because parents, I predict pretty much nationwide, are probably going to have a little bit of a problem accessing those. And we really want them to. These kids are even more at risk from COVID-19 than the 5 to 11-year-olds. So please look up some of those resources for your families now.
And I'll just add, Dr. Glassy, while we're waiting for questions, I really love collaborating with our local early childhood services. I mean, you guys are experts in things that I'm not an expert in. And so please feel free to reach out. I think I speak, pediatricians become pediatricians because they care about kids and they're all generally nice people. So, and very approachable. So, we've done some work locally with our early Head Start folks in Head Start. And that just, it was just started as an email. Somebody emailed me from a talk and so we were able to have some discussions and collaborations, and we invited our Head Start regional health managers to actually our state pediatric society meeting to talk to our early childhood committee. So I hope you all feel comfortable knowing that outside of what you're doing within your work and your immediate colleagues, that pediatricians we love working with you all. And so please feel free to reach out to your local pediatrician. Or if you are in a city that has a residency program, training pediatricians, those are really great outlets. The residents and our trainees really enjoy talking with our families and educating our families.
Someone wrote in the chat that their Head Start Advisory Committee had a family practice doctor come and give a chat. I think that's another way through your advisory committee, your family support person and your health service managers, and just any interested pediatric practitioners in your area to reach out to. Especially as the vaccines roll out, if there's any concerns, if your health department's having trouble keeping up and helping you find resources.
All right. Thank you, Dr. Glass and Dr. Loria,
You
for
bet.
sharing with us the most up-to-date information on COVID-19 and its impact on infants and toddlers. Thank you all for attending this webinar. As usual, I would like to invite you to take action with information you received today and share the information with your staff, colleagues, and families. I believe knowledge is power when it's implemented and shared. So please help us spread the good and be the light to others. I want to thank all the members for supporting our mission. If you would like to be an NHSA member, please visit our website. The link is in the chat. Next week, we have our 4th webinar, Human Superpower to Overcome Trauma with Dr. Darlene. I hope you can join us. For those attending live, you have the certificate link in the chat, valid for 1 PD hour. Click on the link and get your certificate for today's webinar. Last but not least, please fill out the survey. The link is in the chat. We want to hear from you and how we can better support you. All right, Early Head Start family and community, this is all for today. Please be safe. Let's keep rising together. See you next Wednesday at 2 p.m. Eastern Time. Bye.